Welcome back to Real Health, and thank you for staying with us. Now, upper respiratory infections are a common occurrence, especially during the change of season, whether it's a blocked nose, scratchy throat, or that dreaded postnasal drip, which eventually leads to a common cold and bouts of coughing. So we delve into the Real Health medicine cabinet for a natural solution to dealing with these upper respiratory infections. But let's first understand more about why we get these infections and what can we do at home to prevent and treat them. We have Dr. Rory Jean-Jacques to talk to us about this topic. Great to see you again, Rory.
Always great to be here.
Now, tell us, upper respiratory, we're talking lungs, we're talking throat, we're talking ear, nose, and throat, basically.
Yes.
What are the reasons why this is such a susceptible part of the body?
Number one, it's a very, very warm area. And number one, it's the area that's exposed to air. And when people have got certain viral infections, even a cough or a sneeze can send saliva droplets and water droplets, which carry this virus into the air, and it's our main interface. And that's why you have a lot of hairs in this area, and you have a lot of mucus, which is meant to be your first line of defense against viral and bacterial infections. So, I think the most common infections that we've all had, it starts with a scratchy throat. And then it will normally either move up into the sinuses, you get that inflammation in the sinuses, or it will move into the lungs first. But your whole upper respiratory tract, ear, nose, throat, sinus cavities become inflamed. And that inflammatory response is your immune system trying to deal with the viral infection. So rhinovirus, which is cold virus, and that's normally where you just get stuffy, a headache, bit of mucus response and stuff like that. Bit of a scratchy throat. It's normally a couple of days and a little bit of bed rest, and you tend to shift. It's normally quite self-limiting. Whereas influenza can be a lot more intense, and there are multiple strains of influenza, and that's when you Superman down, major body aches.
That goes right through your body.
The whole body aches, you feel like you're dying.
And then you have the man flu on top of that. So.
Exactly, and they say man flu is definitely the worst.
Absolutely.
So there's a distinct difference in the symptoms. But normally what starts to happen is while your body is dealing with this viral infection, it can actually create, while your immune system is dealing with it, you can get a secondary bacterial infection as a result of that. And depending on the color of your mucus, normally yellow response is a more progressed infection, but it's normally where there's bacterial, even where it moves to green. So most viral infection can be treated very, very successfully with the right home remedies and the herbal remedies before they progress.
There's no need to jump in the car, go to the doctor and get an antibiotic.
Antibiotics are normally always the first line with allopathic. And I think it's such a travesty because we're starting to have antibiotic resistance to bacterial infections. In Sweden and in other countries, they test first.
Really?
Do you have a viral infection or do you have a bacterial infection? Test very, very quickly. Okay, what are we going to give you?
Which is the responsible way to do it.
That's the way that we should be doing it, because antibiotics wreck your microbiome, wreck your gut flora. This is where 70% of your lymphoid and immune tissue sits is in your gut lining. Then you have an overgrowth of candida, and then it becomes
suddenly you've got a bacterial infection that you're dealing with somewhere else in your body.
Exactly. So what happens also with postnasal drip is you'll normally have a cold or flu, and you would have had a bit of an infection, and treated with antibiotics, but that bacterial infection still sits in the cavities, and your body starts to produce mucus in response to that. You get that mucus running down the back of your throat.
The whole thing starts again.
Constant. Then you get exposed to a draft, or you've been working too hard, or you're eating incorrectly, and then that bacteria just flares up again. And then it's bacterial. Then it's into the ears, and then it spreads to different parts of the lung. So that's bacterial. Most infections are normally viral. They're not bacterial. So antibiotics, I feel, are given way too soon. So do what you can first in self-treatment or speaking to your homeopath, or and they're amazing things like echinacea, elderberry, golden seal.
So it's really about immune boosters as opposed to trying to kind of just kill all the symptoms. You're really finding a way for your body to helping your body to fight this viral infection.
That is definitely the first point. Sometimes your immune system is so depleted that the infection comes, but a lot of the herbs are directly antiviral and have been through clinical studies. So they address it directly, and you will feel better, but they don't address the symptoms. So modern medicine is, how do we reduce reduce the headache, reduce
Yes,
the
feelings
mucus.
of-
So feeling better while the body starts to. But if you can do that at the same time
Yes.
as trying to address the viral and the underlying immune issue that your body's dealing with, you'll have much, much, much better recovery. Because a lot of the time, people will use all that medication, but then they get sick again
Right.
2 or
Yes.
3 weeks later.
Yeah.
So, and they're wonderful, and herbal medicines absolutely excel at treating these types of things and the way they work with the body. In the last 15 years, not one of my patients in clinic have needed antibiotics.
Really? That's amazing. That's
and there are cases where it is, and when
Yes.
it goes past a certain area and things are nothing shifting, then you need
But
you
at
need
least
to
you
go
know
to a
you've
GP.
done something to work it without going to the sort of obvious antibiotic route, which again is not really going to help the cause.
Absolutely. And simple things as like ginger, garlic, cayenne pepper tea mixed with some apple cider, lemon, and hot water.
Very sort of soothing, warming stuff.
Warming breaks up mucus, gets
Yes.
that your body temperature up as well.
Absolutely.
It activates the body's vital force.
And what about these herbal treatments that work when you've already got the virus as preventative measures, especially coming into sort of winter seasons?
Yeah, absolutely. So you want to be getting a lot more vitamin C. You want to be taking echinacea on a daily basis.
Right.
Elderberry you can be taken on a daily basis. There are herbs which are used specifically for treatment.
Yes.
So that would be golden seal,
Okay.
myrrh, garlic, ginger,
Yes.
horseradish.
Garlic's very antibiotic in nature.
Very antibiotic, but also supports the immune system. Has got antiviral as well.
Right.
Okay. Curcumin, very, very good antiviral. Some of the other herbs are things like powder arco, which comes from Brazil. Very powerful immune support, and something called cat's claw. So these have all been through clinical studies to support immunity. So these are things that you can take on a daily basis as preventative. It's not that you won't necessarily get sick,
Yes.
but when you do get sick, you'll
body
recover
can fight.
much quicker.
Yeah.
And that's the thing. Prevention is better
Than
than
cure.
trying to treat it. So, and our immune systems are under assault with so many different things.
Massively, all the preservatives and additives in food and things like that
Absolutely.
don't do it any justice.
Wi-Fi, stress,
Yeah.
and enclosed environments. In winter we tend to keep warm. We're in enclosed
And you're
environments.
heating everything around you, so anything that's living is going to thrive.
And that also tends to dry out our mucous membranes,
okay.
which then makes us a lot more susceptible. That's
Now, if you've got an infection of some kind, let's say it's got into your chest, you've got the green or the yellow mucus, which is lovely to talk about. But are there home remedies for that help to kind of expel all of those things?
The thing is, when it's progressed that far, I would prefer that you see a practitioner or you get a little bit more of an advanced treatment. Pelargonium sidoides, which is a South African plant, would be one of the better ones because they've done a lot of research around it with chronic bronchitis, acute bronchitis, even pneumonias and things like that. At the right dosage, you can really, really start to shift that infection. You can also do things like certain essential oils, combinations of tea tree and eucalyptus, and you can inhale that just to open up
with a
the lungs.
humidifier or something. Yeah,
Absolutely,
Wonderful.
absolutely. Yeah.
Super. Well, as promised at the beginning of this interview, the Real Health team has added NeoGenesis Flugo into our medicine cabinet. It's a cold and flu fighter that contains a wide range of support for upper respiratory infections. And Rory's here to tell us more about this Flugo product. So you mentioned pelargonium or geranium previously. Now that's a big part of what this is, or what Flugo has.
So it's the foundation of this formula, and pelargonium is a South African herb. They use the root, and many years ago, the Xhosa gave it to the Germans during the Spanish flu pandemic that came through, and people were recovering. And they weren't getting sick, and this is amazing stuff. They took it back to Germany, and they started growing it there. And it's been through clinical studies, works extremely well for children, for ear, nose, throat, upper respiratory, immune support, antibacterial.
Would it be a booster as well as support?
So it's an immune booster, immune modulator, as well as for acute and chronic bronchial lung infections and ear, nose, and throat. So I've seen phenomenal results. It's one of my favorite herbs. So I've worked with it in clinic, and there are other phenomenal herbs in there like thyme, which has proven antiviral expectorant effects, plantain to soothe the mucous membranes, elderflower to open up the sinuses, and it helps as what's called a diaphoretic, so it brings on a mild sweat, so it opens up the pores. It's got ivy leaf, which opens up the lungs, Sutherlandia and olive leaf as your antiviral and your immune support, and then Chinese wormwood, which helps to regulate fever and has any other antimicrobial effects as well. So it's a very, very comprehensive formula, and it's something that we get consistently good feedback from with a lot of practitioners have just said, this is their go-to.
Okay.
And if you've got some kind of infection and it's not, you don't want to be treated with a whole range of medication, this could be a first-line treatment.
Okay.
And dosage is normally 2 capsules 3 times a day for a 5-day course.
Right.
And that should normally cover most
As a
things.
treatment, can you take it as a preventative?
You can do, and I've got a lot of people that say they take 1 capsule a day and they're sufficient. If they're not feeling so great, they just up the dosage.
Okay.
And they don't get sick.
Okay, great. And then in terms of lifestyle, if you're taking something like this, what else should we be doing to just support the healing process?
So a lot more fruit, a lot more citrus. So when you've got some type of infection, you want to support immunity. You want to use things like pineapple and papaya, which have enzymes that lower inflammation and clear mucus. You want to take a teaspoon of apple cider vinegar with a little bit of honey and ginger, which will support the recovery of the body's immune system. More blueberries, raspberries, blackberries, which have a very, very high nutrients that support the body's immune response.
I suppose a lot of fluids as well. Drink lots of water.
Lots of fluids. Keep warm, bed rest. You can have baths with some Epsom salts and bicarb.
Yes, nice.
That really just helps reactivate the body's recovery from infection.
Wonderful. And Rory, where is Flugo available?
So Flugo is available on neogenhealth.com. It's also available at independent health shops and pharmacies across South Africa.
Wonderful. Thank you so much, Rory. Great chatting to you again.
Always great to be here.
Thanks a lot.
Great stuff.